Every time I entered my house, it was something different. I was dying.
When Rebecca Cherop was 4 years old, she lost both her parents. She did not understand then what death meant until 2003, when she was 9 years old.
When your parent dies or passes away, it's very hard for people to tell the child exactly what is going to happen. So I grew up with an expectation of they're going to come back, until when I grew up by myself and discovered it by myself. And so I had to deal with grief. Just dealing with it and coming to terms with what had happened led me into mental illness.
Rebecca's condition would, however, be discovered later in 2017, especially after her schooling and social life became difficult.
I was so withdrawn away from friends. You're in school, but you don't want to associate with people. I had eating disorders, I had sleeping disorders, until after campus, when I was 21. Yes, that's when it really got bad because I became suicidal.
Going without sleep for a week was a common occurrence for Rebecca. However, when the condition worsened, she attempted suicide twice. With no success, she decided to seek medical treatment.
I had to go through the whole grieving process and then accept what had happened and, take the medicine.
After 2 years of medication, she fully recovered.
I am now aware and more educated.
However, when the coronavirus pandemic broke out, it trashed all of Rebecca's achievements in fighting for her mental health.
Being in a state of you're alone, you're in your own space, you've lost your job, you can't see your family members, that alone was it made me go back into the whole depression.
You are now facing economic crisis, jobs are not as available, so people are suffering economically. They're all stressors.
Experts say about 1 in 4 people seeking medical care at a hospital in the country is suffering from mental illness.
Their trajectory of life changes. So if they are at school or at university, they start not doing so well.
In our engagement with Dr. Zul Merali, a neuroscientist at Aga Khan University, it is noted that mental illness often begins in early years of life.
When mental health strikes you in the younger days, it may be very insidious. You may not recognize it. You may not want to recognize it. People tend to suffer in silence. If you look at suicides in the young people, it's becoming the leading cause of death.
Aside from the millions of Kenyans losing their jobs in the corona pandemic, the government's poor investment in its public's mental health has been cited by experts as a contribution to the growing number of people suffering from mental illness.
We hardly have adequate number of psychiatrists and psychologists to be able to treat people who are suffering from mental ill health.
And to those who are afraid to talk about their problems in life, some of the symptoms of mental illness include
their sleeping patterns change. Either they sleep too much or they can't fall asleep. You start thinking about negative thoughts all the time and you can't seem to break out of it. Things that used to give you pleasure no longer are pleasurable.
Dr. Zul has backed a bill in Parliament that seeks to decriminalize suicide attempt for anyone found to be suffering from mental illness.
We are one of the very few countries in the world who would consider suicidal acts as being illegal. We need to change that thinking. And that goes towards helping destigmatize mental illness. It goes towards giving help to those that are in need.
The input of government efforts in formulating specific policies and citizens in avoiding stigma against those suffering from mental illness may contribute significantly to the reduction of the number of patients in the country. Ben Kerera, K24, Health Beat.